Hi everyone, I am Dr. Prasun Vaidya and in today's topic we are going to discuss on the symptom called as fever. In every symptom series of my video series, you will see the causes of the symptom. So today also we are going to discuss the causes of fever. But before that, we'll discuss a few basic terms about fever. Fever is when the body temperature arises above 100 degrees Fahrenheit. Then you term it as fever. Fever in medical term, the medical term for it is pyrexia, and we have grades for fever, either as mild, moderate, and severe. If it is a mild kind of fever, the range is between 100 to 102 degrees Fahrenheit. If it is a moderate kind of fever, the body temperature range is between 102 to 104 degrees Fahrenheit. And if it is a severe kind or a high grade fever, then the range lies between 104 to 106 degrees Fahrenheit. If the temperature range is beyond 106, that term is known as hyperpyrexia. So we measure fever with the help of a thermometer. But in case of pediatric age groups, like babies around 0 to 3-year old, we use a anal thermometer or a tympanic membrane thermometer. But in COVID era, we are seeing fever, so we are generally using thermoguns instead of a thermometer. So the first and foremost cause of fever is infection. The body temperature rises within the body if there is any underlying infection in our body. The infection could be either be bacterial, fungal, viral, parasitic, protozoal, any of it. If it is a bacterial infection, the bacterial infection is localized to one part only, such as in case of UTI. UTI is urinary tract infection. It is confined to urinary tract only, or the sore throat, Streptococcus throat. So it is confined to the throat only. And bacterial infection is localized in nature. That's what it is. And it is not much contagious. It may be contagious. As in case, bacterial infection can be caused due to an dental implant or dental extraction, or due to even after post surgery you could face bacterial infection. So in bacterial infection, antibiotics are given. Another case in bacterial infection could be due to food poisoning. If you have stale food, bacterial infection could be there. In case of viral infection, in viral infection, we have runny nose, sore throat, flu, common cold. Even COVID-19 is a kind of a viral infection. Viral infection can spread throughout the body and it is contagious in nature. And antibiotics are not effective in viral kind of fever. And viral fever duration is around 3 to 4 days. But as in case of bacterial fever, the duration may range from 10, 14 days or beyond one month also. So that's the main difference between bacterial and viral fever. If it is a protozoal kind of fever or a parasitic kind of fever may be due to malaria or giardia. Fever along with any other symptom like fever with rashes, it could be due to measles, rubella, chickenpox, or fever along with lymphadenopathy, it could be due to infectious mononucleosis or lymphoma or either neutrophilia. If the nature of the fever are of five kinds, it could be intermittent, like the temperature has risen in the morning and it has degraded in the afternoon and again it has risen in the morning. So this kind of fever pattern, step ladder kind of pattern is seen in typhoid kind of fever. So the nature of fever could be step ladder pattern kind, or it could be a continuous remittent or intermittent or etc. Whatever. And fever, another cause of fever which is seen very frequently immunization, if you have taken any vaccine, then the you have injected antigens, a viral antigen molecules in your body. Hence, the body is reacting to those antigens. The immune system is reacting and creating fever, the temperature. So I was saying fever either could be due to immunization or it could be due to heat exhaustion or sunstroke. If you're exposed to the heat of the sun and for a prolonged time the temperature rises, so it could mimic a fever-like symptom. And even fever-like symptoms could be there if you've come from a warm exercise or if you've had heavy clothing on yourself. That also could arise fever-like condition, or it's not fever, but it could mimic fever. So I have discussed all the causes. First is infection, another one is fever accompanied with rashes, fever accompanied with any kind of lymphadenopathy, fever after immunization, or fever mimicking conditions such as exercise and all, sunstroke. That's all for the day. Thank you. See you next time.